endocrine causes of RIF. We previously discussed thyroid disorders as a cause of RIF. Now we will be discussing further causes of RIF. Vitamin D deficiency, PCOS, diabetes mellitus, and obesity. So these all are endocrine causes of RIF. Out of this, thyroid disorders we already have discussed. So coming on to vitamin D deficiency, vitamin D is an immune modulator. It is a vitamin, but it is an immune modulator. Vitamin D receptors are expressed in placenta, endometrium, and ovaries. And calcitriol influences gene expression involved in endometrial receptivity. What are the genes involved in endometrial receptivity? HOXA10, homeobox6, kel binding, and osteopontin. All these are the genes involved in endometrial receptivity, and vitamin D has effect on them. Increased risk of early spontaneous pregnancy loss is seen when vitamin D concentration is less than 20 nanogram per ml. And there is positive association of vitamin D with endometrial thickness too. Coming on to polycystic ovarian syndrome. How PCOS is associated with RIF? Because there is increased expression of androgen receptor which affects the endometrial receptivity. Apart from endometrial receptivity, the PCOS patients have compromised quality of oocyte, thus the embryo quality. And there is something known as ADAMTS1 expression which is altered in patients with PCOS. What is ADAMTS? It is aggregan, disintegrin, and metalloproteinase with thrombospondin motif 1. ADAMTS1 is expressed in granulosa cells of preovulatory follicles, and decreased ADAMTS1 levels are closely related to lower oocyte fertilization capacity. So, ADAMTS could serve as a marker of fertilization capacity. Another thing is, a positive predictive effect of ADAMTS on implantation has a potential role as a marker of high quality embryos in women with PCOS. Coming on to diabetes mellitus and RIF. Diabetes is associated with impaired endometrial receptivity and compromised oocyte and embryo quality. How diabetes affect embryo quality and endometrial receptivity? Whenever there is hyperinsulinemia, it is associated with impaired expression of estrogen receptor, progesterone receptor, and HOXA10 genes, thus affecting the endometrial receptivity. Coming on to obesity and RIF. Obesity is also associated with impaired endometrial receptivity and compromised oocyte and embryo quality. As we all know, obesity is associated with hyperinsulinemia. So, increased BMI has impact on implantation rate. And class 3 obese patients, they have highest overall rate of miscarriage. Overweight and obese women undergoing IVF who have fewer oocyte collected had higher risk of implantation failure and miscarriage than women of healthy weight with same number of collected oocytes. So we will be discussing obesity in detail later on in another video. So these were the few causes of RIF, endocrine causes of RIF. Thyroid disorders, PCOS, diabetes, obesity. So these all are very important causes of endocrine causes of RIF. Thank you.